Well, right now it's disconnect.
Thank you for the opportunity to present. The inspiration for this talk came from one of the studies, actually multiple study groups that I'm in, and there was a lull in the conversations. I was like, oh, you always have interesting patients, and they might have used a different word than interesting that starts with W. And why don't you talk about one of your patients? And that happened. So I was thinking that maybe I should just pick a week and talk about the patients that I see. So that's and then what I learned from it, not just the interaction. I don't have any disclosures. There's no conflicts of interest. So I did want to thank the giants who came before me, and as other people have mentioned, I stand on the shoulders of these giants. I want to thank IBO, our local study group. I'm also on Tuesday Think Tank, which meets every Tuesday morning at 11:30 and has been meeting since March 2020. Not that they gave a prize for attendance, but I have to say I haven't missed a single meeting, no matter where I am in the world. And that's because I gained so much from this interaction. And I'm a solo practitioner, and I love that interaction with different study groups. Highly recommend it. So I put my questions here, but I will skip them because I have them at the end as well. So I'm going to go through some patients. It's not so much about the details of the specific patient. And so I have some findings, but it's not about the findings. It's what you take from the patient. So I saw DK initially about when he was 3 years, 10 months old, nonverbal. I get a lot of referrals from internet searches, and some parents have posted how helpful it was for them to come to my office. So he came in, he was nonverbal. First sounds at age 3. So he did make sounds. When he came into the office, he took one look at me and started bawling. And so I knew he could make sounds. And the parent said that when he doesn't want to do something, he covers his ears. And in my mind, that is a signal to think about something. And he was in an early intervention program in elementary school, which has in the morning program, and then in the afternoon he was going for program. ABA in the morning and then afternoon in the elementary school. But the parents noticed that he had an exotropia, and the other caregivers had also mentioned. Okay. So he was not able to respond to some of the testing, like the stereo, which is usually my first test. And initially he was just exophoric, and then as testing progressed, you could see the deviation. And that I got some findings, a lot of them were brief attention. And sometimes as the testing progressed, I was actually able to get him to do more. And we did matching. He knew some of the letters in his name, and we could do Snellen matching, keeping in mind that it's limited to the letters in his name, which are pretty short. And then I had a treatment plan. I like to give things to parents. And even if they say that they don't want to come in, here's some stuff that you can do at home. And he wasn't sure they could fit things in. What I didn't realize was they were going to give that sheet to that OT, and the OT was then going to implement. And I wanted them to work on it and then come back in 4 to 6 weeks. And I did want them, in my mind, based on some of the findings there, and the plus I was seeing was thinking I might want to give plus, and he was very tactily defensive. So I said, okay, try having him wear sunglasses and you take them off before he pulls them off his face. So to kind of get used to having stuff on his face. And they weren't really combing hair. So if you can touch him even with your fingers, like brush his hair. So he gets used to having things in his personal space. And they came back 2 years later, because it was 4 to 6 weeks later. He's in kindergarten, and they've seen a lot of improvement function-wise. He's doing speech therapy, ABA, OT, and the parent said that he gave the list of, and I had sent an email reminder just to check how things are going, and there was no response. And he was on, now been diagnosed with asthma and was also on inhaler. So again, my findings, I got a little bit more. I'm seeing still a little plus. I did prescribe, and he's more intimate than XT. I'm going through the slides fast for a reason, because in the end, it's not about the details, it's about the findings. And I recommended optometric vision therapy, not the OT version, although you can still do that, and the PCN. The parents parents said it would be too much. He's still doing ABA, he's doing speech. And I was like, that's fine. I can see him at another point for the therapy in office. And I did explain how my bias is with lenses and some of the things that we do that is a different approach to it. Of course. So they came back a year later and said, he's in first grade and he's starting to read. It's slower and they're getting help and they wanted to see any changes. The OT also thought that it was time for an exam and recommending because they were seeing some aspects. And this person teaching reading was seeing that he's not following as what he should be on the page. And the parent was concerned because the other kids at recess, they're playing with the ball and he's not looking at the ball when he's trying to catch. Seems pretty lined up. They did start leucovorin and started with 2.5 milligrams, and he's gradually increased the dosage. And the parents found that there was a huge change with it, and both in terms of verbal skills and attention.
What is the medication?
We'll get to. So these are my findings, and I was finding a little more minus in the right eye than the left eye. And the question was, what is that medication? And that's where it comes to. The parent's question was, how come you didn't tell me about leucovorin? And I was like, oh, okay, I didn't realize that you were expecting me to talk about that. Leucovorin is a drug that works within the so the MTHFR process, and it's the folinic acid. It's a B vitamin, and there's some changes that actually there's so many people using it that American Pediatric in September came up with a recommendation that they don't recommend it, and it's not used for treatment of autism. It's not a recommendation that they have, but I have so many patients on it, so I was aware of it. But since they were seeing a developmental pediatrician, I didn't talk about it. So I think that begs the question, that's like, how much information do you give parents? What do you discuss with the parents? What are your recommendations? But they were upset with me for not mentioning, because they're like, if we had done it before age 3, not that I saw him before age 3, we would have had more changes, because that's what parents are reporting on a lot of the board. And so leucovorin, there's a test done called the FRAP, folate receptor antibody test. It was developed by Dr. Quadros at SUNY Downstate. I have a niece who works at that hospital, and I had her go speak with them. And it's been found that it's that B9, and it tests both the receptor and whether something's blocking it and the receptor antibodies. And then based on the diagnosis and based on the test, they will recommend and often start lower amount and then gradually increase. And it is tied in with cerebral folate deficiency syndromes as well as other neurodevelopment and neuropsychiatric disorders. So I talked about before. What is our role? Like, what do we do, and how do we help patients understand what is our role also? So patient G, so she came in, she was 10 years old, 4th grade, struggling with reading. I had seen a sibling who'd done a huge amount of improvement. She's not good at reading aloud and difficulty with spelling and mixed up letters. And so we did her exam, a little bit of hypophoric, esophoric, and yes, I would call that CI, even though there's ESO, and there's some accommodative issues. And so looking at the testing, my recommendation was visual processing testing and then the visual processing evaluation, vision therapy and visual processing evaluation. And you can see some of the scores are really good, and then others are a little bit lower, right? And so it's not, in some ways, it's almost bimodal versus across the spread. So I owed them a makeup. They missed a session, and the rule is if you miss a session, as long as you call email, let me know, you get a makeup. So I had a block after, and I said, would you like her to stay for an hour session? And the dad emailed back saying, no, because she's still losing her place and she's still stuttering. And I was like, what? I didn't realize that part of what they were looking for was for her to no longer stutter. And I don't know where in my explanation of visual function and areas we're going to tackle in their mind, what they heard was she would get better at reading and therefore she will not stutter, right? So there was a disconnect and a mismatch in what we were talking about and what we were working towards improving. And so I wasn't sure in my mind, did I not explain it or did they not hear it, what I intended? Or did they research somewhere else and then saw somebody whose kid got improvement and then they took that to mean that their child would also. And she has improved significant amount. But she goes to a private school where they go around the classroom and everybody reads aloud. And she's like, when I see the first couple sentences, it's short, I'm fine. It's a bigger paragraph, I cannot see anything. It just all glazes over. And so we didn't talk about what to do about it, but she still stutters when she comes in that situation. So patient T3, 80-year-old who's seen diplopia, the one image was higher than the other, and he has difficulty with reading, he mixes up numbers, and he can no longer drive at night. He has glaucoma. He's had a health history that's kind of complex with long things, and he did say he was, they were watching his heart. And these are my findings. As I was doing EOMs, I could see that there's a restriction in abduction. And I did ask him again, any falls, anything else, any hospitalization? He's like, no, no, no. His wife had come with him, but she, as soon as he came in, like she didn't come into the office, she went to the restroom and then I guess went to do, like answer phone calls. There's some chairs in the hallway, so I think she was there. And then my 90 days wouldn't load, but there was, which showed the restrictions. And then when the wife came back, I'm asking, look, okay, none of this makes sense. Like, what happened? Like, did something change? Not that it would change my treatment, but would help me understand. And the wife's like, oh yeah, he had 3 strokes. It was here, here, there. So front and the right side and in the back. And it made more sense that where I was seeing that the eye movements and the restrictions. And so he seemed really with it. So when he said, oh, like I was never in the hospital, things, I trusted it, but he obviously, on some cognitive level, did not even remember, right? So it, as I said, it didn't change necessarily what I would do, but I did prescribe some prism, and then I also did binasal, so I forgot to add in, and recommend it in office and home therapy procedures. And he had such an improvement, but, and I'll mention with one of my other patients with binasals, we're kind of say, okay, if we do some of the therapy, maybe we'll need to put the prism off and don't prescribe prism initially. I feel like there's restriction, but the lady wanted to give the option. He came from far, so I wasn't sure. It was, I think, a couple-hour drive to come to my office. So TT, I added her, that was the newer slide, because this was just last week, and she is not an optometrist, but a healthcare professional, and she wears contacts and then wanted to wear glasses during the pandemic, so her dog chewed her glasses. She found that when she takes the contacts off, she can see, but when she takes the glasses off and she went to somebody else, she cannot see anything. She's like, I am so blind, it's like I cannot even see something right in front of me. And it does not happen with my contacts. And she went back to the other doctor and they adjusted the glasses, they moved them higher, they moved them lower, they changed the nose pads, and they did not schedule another exam. She has history of multiple TBI, and she was hit on the top of her head about 1.5 years ago, and 8 years ago jammed her cervical spine. She was in a profession where during her training, they did a lot of adjustments on each other to kind of learn how to do it. And she felt like she was never the same after everybody in the class practiced on each other, because they didn't necessarily know how to put you in alignment. They just tried to align you. And there was not necessarily an instructor who said, let me put you back the way you came in or closer to what should be there. And so some of the issues stem from that. I should not have done that, Lou. So it does have history that she fell down 4 years ago, and she has a history of COVID, and there was brain fog after COVID, and she had difficulty focusing on screens, but felt that she got better after that. She has a new job where she's no longer working in her profession so much as she's consulting, and like, if you have a practice that's not running well, she will reorganize your practice. You have trouble with people not paying or getting money from insurance, she will help go through your billing and doing that. So she's on a computer a lot. She just started D3 in vitamin K. Her current RX is plus 150 minus 4, X 104. Left eye plus 3 minus 175, X is 65. And that's very similar to a context. You can see with that NISO what happens with the contacts versus the glasses and why she's having trouble. So these are my findings, which are, she did have a head tilt and multiple fixation lessons, receded nearpoint convergence. We're looking at all of that, and she's suppressing the right eye from 3 to 6 feet, but beyond 6 feet, she's fused. And she did have luster diffusion at near with the RX. More of her, and we did angels. I'd like to do standing angels as part of my exam, and she was so discombobulated after that. I never got to talk her surface. Felt like we needed to regroup. Thanks to Smita Trivedi, and it was a polyvagal thing, so we kind of did that to kind of get her. She was so upset after the exam. I put binasals on, and I always warn myself and patients that sometimes there is an emotional reaction. They can be with binasals. I've been burned before, so I was like, okay, so we'll, I'm going to put them on. I put one eye, no problem, put the other, and she basically fell apart. I actually missed my 11:30 Zoom therapy patient because I couldn't leave her the way she was, because she had to drive home and she came alone. Like that's a danger. I would rather work on settling this. And she felt that nobody else understood how she felt when she took the contacts off, the glasses off. They were like, just wear contacts. And she went back to the other person. That goes back to that empathy and communication. She didn't feel heard. She felt like she was so alone in that blur and that space. She's like, I cannot even get up and move. I used to be able to do that, and now I cannot. I'm limited to that state. And then she emailed to say, the tape seems to be helping. I felt my eyes a bit tired by the end of the day after wearing my glasses, but the tape seems to help when looking at screens. And so in the end, it comes down to the insights that we have. It's communication, in my mind. It's how we communicate with parents and patients and the community at large, and how they hear us, because they have their own filters. So the parent who thought it would help with starting, their filter was allowing them to hear that, right? Or the other optometric office that she went to that heard that I see blur, they thought, well, she's looking through the progressive, or she's looking through something else. Well, let's adjust the glasses, versus saying, okay, let me just see. They never offered her an exam, right? And I feel like I don't know if the doctor would have done it, but I don't know if the message went through to the optometrist in that practice. It was just always the one. So no matter what road you take, and if you ever go to Switzerland, there's a Schengen Club, I might be saying it wrong, but that's a phenomenal life. It's clear communications, setting expectations for yourself and for what in terms of outcome possibilities, without limiting what the patient can end up being able to do, and having goals. And then when you're taking history or communication, even when discussing what your treatment plan is, having caregivers and others, even just calling the other parent on the phone, and so they can listen in. So the more people that hear it and they're able to assimilate it, because it is heavy in terms of what we communicate. Right? It's recognizing and it's describing something that they're not familiar with, even though they're experiencing it. And so giving them all the tools and the scaffolding that they need. This is one of the references. on the practice. So my questions are, what have you learned from your patients? And then how have you incorporated it in your practice? Thank you for the opportunity to present. What have you learned from your patients? And how do you incorporate it? And it's not just with your patient in your practice, but in life, right? Like when it's not limited to just how do you incorporate it?